Okay, ladies and gentlemen, members of the committee, members of the public, as always, thank you for your attendance, especially during this time of year with the holiday season beginning. It means a lot to me to have you be here and provide input. Let's go ahead and call the meeting to order. As you know, this is the last meeting. We will have one additional witness. That witness will represent the teaching profession. And I will let the Senate Education Chairman introduce the witness. Before we have that introduction, we will take recommendations from the members of the committee. After we hear from the testimony, we will put that in a final draft form. I will have each and every member of the committee sign off on it, and then we will send it to the governor, the lieutenant governor, and the Speaker of the House. So without further ado, Mr. Chairman, you recognize.
Thank you, Mr. Chairman. Before I get to our witness, I thought I'd let the members of the committee know, before you have some comments from educators. That's about 4 pages that I've received. Chairman Bennett's probably received as well. With Chairman Zumber's permission, we emailed those out, as well as giving you a hard copy as well. So just for your edification.
Mr. Chairman, would you like to add that to the report as an exhibit?
I would, please.
Any objections? Hearing none, it passes.
Okay. On Zoom, we have one witness today. His name is Jason Reed. He is a teacher at Lewisburg Elementary School up in DeSoto County School District. He is someone that has worked with MPE, and they've selected Mr. Reed to come before us. He is aware he's got about 10 or 15 minutes to speak, as well as answer any questions any members of the committee may have. And, hopefully just give his point of view as a teacher representative throughout our state, just to verbalize some of the comments that have been made in the written form. So is Mr. Reed on Zoom?
Yes, I'm available.
Okay. If you could go ahead and tell us who you are, where you're at, and just provide some comments or commentary you may have on the health insurance program as you see, and some of the issues that you think we could use or do to help maybe help your situation. Thank you.
Totally. Yes, thank you for having me, and good afternoon, everybody. I'm gonna talk my 10, 15 minutes, and then I'm happy to take questions at the end. But for a little context, my name is Jason Reed. I'm in my 15th year of teaching in Mississippi. The last 6 or 7 have been in DeSoto County up North Mississippi. So 15 years overall. My wife is also a teacher in Mississippi. So we're very connected with the teaching, with the program here, with the health insurance. I also have 2 young kids. They're both in school, so young elementary school age. What makes me unique is I'm actually a 2-time cancer survivor, and both of those bouts of cancer I've gone through under the plan. First one was about 10 years ago. I was only 27 years old. And then the second time was just last year at 37. So I have I've had a deep dive into our health insurance. So I've used it extensively, and I am very grateful for it. But my experiences really have given me a much deeper understanding of the plan than my colleagues. So I'm like the go-to person for advice. I've experienced the pluses of it for sure, but I'm also aware of the challenges that my colleagues and I face with the plan. And my experiences are unique. So my experiences and perceptions don't necessarily match those of most of the state or my local colleagues, let's say. But the major concerns, I broke it down to, I have a couple major concerns, and then I have a couple recommendations at the end. So for the major concerns, number one, first and foremost, is the premium costs and the increases. So those are the sticker prices that the teachers see that really drive the perception. The narrative always is that pay raises are always coincide with raises in insurance. And I think that that is partially true, but I think what's also true is that insurance also raises when we don't get pay raises. And some of the data can show this. So in 2019, just in the last 5 years, we had a $1,500 pay raise. Well, at the beginning of 2019, before that pay raise would have been implemented, there was a 3% increase in the insurance. And then the second half of that school year, another 3%. Then in 2021, an additional 3%. And there was no pay raise after that. In 2021, we did get a pay raise of $1,000. Then there was a 6% increase on top of that in 2022. Then in 2022, we had the larger pay raise that everyone's very aware of, averaging about $5,000 or so. And that was followed with another 6% increase. And now we were just alerted during open enrollment that in 2024, it's another 5% increase. So over 5 years, that's a 26% increase. So to help you understand what a teacher is feeling is, and I'm the one that dives into the numbers. Most teachers don't know any of those percentages, but if you take the 5,000 pay raise for me that I got in 2022, after the normal deductions and stuff, it amounted to about a $284 a month increase from the prior year. So at the same time, the health insurance rose an additional $18 a month to $317 a month. And that's really just to cover my 2 kids, because my wife and I both have the cheaper base plan where the state pays the 100% of the premium. So just for my 2 kids is $317. So I know it's not apples to apples because I was paying for health insurance anyway, as I needed to, as we would be doing. But teachers are looking at, my pay went up $284, but it's still not as much as the health insurance cost on a monthly basis. And I think that's kind of what ends up happening. Another thing is that the premiums are the sticker price, but it's the rise in the deductibles and the co-insurance during this time that really, I think, gets people. So during this time, I'm going to throw a lot of numbers out, but I promise I sum it up at the end. But just go over the last 3 years. In 2021, there was a 3% premium increase, as we talked about, but there was a $300 increase in the individual deductible on the Select plan, which most teachers do have. That's the more expensive one. They also had a $600 increase for the family coverage deductible. And the co-insurance maximums increased to another $500. So all of this is on top of the premium increase itself. The very next year in 2022, there was the 6% premium increase. Deductibles raised another $200 more for individual and $400 more for family coverage. In 2023, another 6% premium increase. And now deductibles raised again, $300 individual, $600 for family. And it was in 2023 where the Select plan, the deductible now is $600 higher for base than on the family plan, that was the first time that had happened. It used to be you were paying more for the Select plan because it had a lower deductible as one of the major reasons why you would pay more in premium. Now it's flipped. So to sum it up, the Select family deductible rose $1,600 in only 3 years, coupled with 15% premium increases. So what's happening is, teachers are paying more and more and more monthly just for the service, but you have to pay more and more and more out of pocket just to even see a benefit. In 2024, now it's another 5% increase. And now on the base plan, I know the deductibles are going up another $200. And I know that's to meet the federal law for the health savings accounts. So in summation, really, we're just paying more monthly for coverage and having to spend more and more until the plan actually kicks in at all. The feeling that teachers would have is that the goalposts just keep moving. And unless you go through something very catastrophic like me, you really don't see a lot of the benefit. And to give you an example, just in our current calendar year, in 2023, my family, my wife and I are both state employees, and we're really just paying for our kids in some respect with this premium. We're paying $6,800 in premium out of pocket $3,800 in premiums out of pocket through our monthly checks. And then a $3,000 family deductible. So out of pocket, we're paying $6,800 before the plan pays any tangible benefit. And then we still pay 20% of all costs out of pocket until we reach our individual or family maximums, which currently the individual max is $6,500 and the family is $13,000. So the 2 times that I've reached that, obviously, one was an individual when I was 27. I was still not married and didn't have children. And now I've reached it as the family. So in the 2022 year, you know, we neared the 13,000 out of pocket max. I mean, I had obviously been the bulk of that, clearly. And this is all on the less used base plan. And I think that's important because I know in the information that you got in your August meeting, it shows a lot of the plan participants are on select and they pay even more. So to bring this section together, why does it all matter? I think that all of these factors and others combined lead to many, many teachers leaving the profession, particularly when they have children or they get married. Often those events happen earlier in their careers when the take-home pay is even less. You know, I'm 15 years in, and I have a AAA license. I'm at a different pay scale right now. But if I was younger, you know, and those things happen, I can see why people leave. And sadly, the other part of this is that many, many people that I've worked with over the years in 3 different school districts, they just forego treatment for minor and preventative care. You know, they don't understand that they like, well, we pay for health insurance out of my paycheck, but when I go to the doctor, I pay 100% of the bill because they haven't met their deductible. And they after a couple of experiences of that, they just refuse this treatment. And you know, that's not a smart choice, but those are people's lives. And, you know, you can't tell people what to do. And it's just very frustrating. And when I look at the information that y'all received in August about, you know, the top 4 chronic conditions that constitute the bulk of plan payments, you know, for me, I can't help but wonder how being more proactive and using benefits could mitigate these conditions, you know, diabetes, even cancer, which is not something that often is preventable, but the earlier you catch it, obviously, the cheaper it is to treat and such. So here in DeSoto, obviously we're in a unique spot because we're so close to the border of 2 other states. I can't tell you the number of teachers that, and we're in a growing area in the state, but the number of teachers that leave to go to jobs in Tennessee, teaching jobs in Tennessee and Arkansas. And teacher pay is part of that, but it's also based off the health insurance. One other piece I want to hit on that I don't have a lot of information on, but I do want to just make sure it's out there because it does apply to a lot of teachers in the state. And the first is the pharmaceuticals. And in the documents that y'all just added to your files with all the teacher comments, the pharmacy stuff comes up a lot. That's not something that I had as much personal experience with, but you can see a really common theme and complaint is just a lot of medications that were previously covered no longer being covered and having to go through lots of appeals processes and just the perception being like automatic denials. And that is very challenging for people that are on medications that have to go to, you know, the doctors need to prescribe and also need to be in right dosages and changing and such. So that's in a lot of the comments. And the second piece is I also want to say the retiree benefits because retirees basically have the option to stay on the plan, but they have to pay the full cost until they become Medicare eligible. And I look at those prices and the way I interact with retirees is through the Facebook page that the state teachers typically are on. And the very common thing is people just don't know what to do. And, you know, these are people that are retiring after after teaching in Mississippi for 25, 30, 33 years, and they can't afford the gap until they become on Medicare. Further looking ahead, because this is what I would fall under, in 2006, there was the split between Legacy and Horizon. And I didn't live in Mississippi during those times, so I don't understand, you know, exactly what happened then, why there's a split. But I look at 2031 as the first year that anyone hired after 2006 would be eligible. And the prices for what will be Horizon retirees are just going to be, there's no reasonable way that any of these people are going to be able to stay on this plan. So, you know, as far as the state taking care of its retirees and of its, you know, public servants over a career, I do think that's something that can really be looked at. All right. So with all that being said, I do have some ideas for some possible solutions, and I whittled it down to just 3 for simplicity. And these are ranked in the most significant to educators in our state for sure. So number 1, the premiums just have to come down. The state would obviously have to pay a greater share especially for family coverage. And I think that's the key. It's the family coverage. And when I use the word family, I mean when you're covering your children or your spouse or both your spouse and children. In the chart in your August meeting that plan official shared with you, it shows that for family coverage in Mississippi, the state of Mississippi covers 34% of the premium cost, while every surrounding state ranges from a low of 61% in Louisiana to a high of 75% of that cost in Tennessee and Arkansas. Regionally, Florida, Virginia, Georgia, and South Carolina all cover over 80% of the cost. In real dollars, and this is where it comes down to people choosing jobs, for me in DeSoto County, well, for South Mississippi is going to be more effective with Louisiana. Louisiana, that's a difference of $168 a month. For where I am so close to the Tennessee and Arkansas border, in Tennessee, it's a difference of $320 a month. That's almost a $4,000 difference in over a year. And Arkansas, it's $482 a month, which is a difference of almost $6,000 a year. So, we have done a lot. We've worked really hard to get teacher pay up to the surrounding states and the Southeastern average. But that's a $6,000 difference for me to go teach in Arkansas. And I understand that it's not always apples to apples. Like maybe their plan has a deductible that's twice as high as ours. I'm not sure. I'm not an expert on the other states' plans, but I can't help but wonder, why is there such a difference? We as a state, we talk about competing with these states all the time for graduates, for new teachers, for veteran teachers. And salary is obviously one huge part that, someone in college is looking at, which state pays what. And I get that. And that gets a huge coverage in the media, and it gets huge coverage politically in campaigns and in legislative sessions. But benefits are really the less talked about, price point. But I can assure you, and I'm at my school right now, no one's here because we're on break, but there's a nice quiet place. But I can assure you, within these walls, this is talked about just as frequently as the pay, because we deal with doctor's appointments and health insurance and illnesses for ourselves, for our children all the time. So this is talked about for teachers just as much as the pay. The pay is something that we know what we signed up for year to year. It's when we never know what's coming with the health insurance, and between the premiums or the denials on the pharmaceuticals or the costs that you get when you actually go to the doctor for everything. All right, so that's my first recommendation, is about the premiums. Second is about, we need wellness incentives that decrease the premiums. So the previous incentive was very convoluted and only took $300 off the top of the deductible. So you had a few different steps you had to accomplish, but then you only got a decrease in the top of your deductible. So if you didn't meet your full deductible, you never saw a tangible benefit. The motivation just wasn't there without seeing a real decrease in cost. So any wellness incentives we can have that decrease premiums, gym attendance, BMI metrics, wellness visits. I know that this stuff all happens in other plans. And finally, the third recommendation is just retiree incentives. And I don't have a perfect answer here, but maybe credit for service years equals a decrease in retiree premiums. The longer that you work for the state, the more the state will pay their share until you are eligible for Medicare, something like that. So to sum it up, I just believe that some combination of these solutions has the power to attract new teachers to teach in Mississippi. It can keep current teachers employed after starting families within our state and schools, and help many working state employees and teachers receive the medical care that they both need and are already paying for. So together, it could be a better educated and healthier state. So thank you for your time. I'm happy to stick around and have some questions. The reason I'm on Zoom today is that, lo and behold, and appropriately enough, I have a doctor's appointment in about an hour. So
Thank you, Jason. Do the members of the committee
you.
have any questions for Jason, or any comments or input in response to his testimony? Mr. Chairman, you recognize.
Thank you, Mr. Chairman. Mr. Reed, just one question. I mean, we talk about the price and so forth quite a bit. What about your experience with the health insurance? I mean, do you have good, do they pay on time? Do they Do they refuse your service, things of that nature? How would you rate that?
Yes. So there's two answers. I'll give you my personal answer, and then I'll give you some of the other problems that people do incur. So first, for me, my experiences overall have been very positive with the payments. Now, like I said, my experiences are pretty unique, and that I was having surgeries that cost $100,000, right? So like, what I was going through was just another level. Now, I found that yes, the plan was responsive. It paid. I never had issues with that. The only issues that I've had is that with my particular type of cancer, I am no longer able to produce testosterone, and a lot of my testosterone treatments are not covered. And interestingly enough, the cheapest treatments that are available, the plan does not cover. They previously covered it in years past, but they don't cover it anymore. They only cover now the most expensive treatments. They only recover two different types, one of which is the most invasive, and that's actually what I'm going for in an hour. So I think that's very interesting. I know that the pharmaceutical component is something that a lot of people in the plan have a problem with. And like I said, the comments are going to be more helpful than my personal experience, but I can at least give you that. I just find it odd that they deny a lot of my testosterone treatments, given that they know my situation with the cancer, given that I was covered under the plan during all of this. The second piece is the dispute with hospital chains. So I know y'all are obviously currently in Jackson, and this UMMC dispute was pretty large news. Up here in DeSoto County, we didn't have the same experience with UMMC, but up here there was a dispute with Methodist, which is the huge provider in the Memphis area, and particularly with all of the Le Bonheur hospitals and clinics for pediatric care. So basically, there was like a pretty long time that only recently wrapped up, where going to any of the Methodist or Le Bonheur clinics or hospitals, the plan wasn't covering that. And that was very frustrating, because that was the majority in our area, the super majority of people's pediatricians, and also the only children's hospitals around.
Thank you, Mr. Reed. Thank you, Mr. Chairman.
Yes, sir. Mr. Chairman, any other questions or comments from the members of the committee? Okay, seeing none, Jason, we want to thank you for your time. Thank you for sharing your experiences with this committee, and happy Thanksgiving to you and your family.
Happy Thanksgiving. Thank you so much. I'm really proud of y'all for working on this. It means a lot to the state teachers, I promise. Huge.
Thank you for those comments.
Thank you.
If I may, let's try to get to the big picture and provide some context in response to Jason's comments. And Drew, help me out if you can. Am I correct in stating that under the plan, non-pharmaceutical expenses have been relatively stable or have only slightly increased for the last several years compared to pharmaceutical expenses? Yes, ma'am. Okay. That's what I thought. And in following, excluding last year, where I had been told, I think pharmaceutical expenses have been relatively stable, thank God. Prior to that, they have increased on an average of 20% annually.
I don't know exactly the percentage, but we just see pharmacy costs continuing to rise.
So if we can handle the increase in the pharmaceutical expense, then obviously we can hopefully see an overall reduction in the health insurance plan premiums.
I think the pharmacy benefits, in my opinion, and Bert and Laura might feel differently, are the pharmacy is the number one thing that we just have to constantly wrangle. I think the medical side, I think since we've been doing this so long, is a lot smoother to me, and costs have been more stable. But drug costs in general are obviously going up. So, we're trying to think of ways to combat that. And that's one reason, I think maybe 2 years ago, we came up with another formulary to possibly, save some money. And then there was an appeal process if your drug that you were taking was not on that formulary. any longer, then you could appeal that process.
Thank you, Ms. Liz. Any other comments or input? Mr. Chairman, you're recognized.
Drew or Liz, is there anything in our contract with our pharmacy benefit management company that would prohibit us from finding the price that the PBM pays for a specific drug and the price that they're reimbursing the state for it? When does that contract come up for renewal? Or what does it expire? Two years from January 1st. Do you think that would be helpful if there's a way we could get some of that information that we spent a better part of a day with a pharmacy benefit manager expert, for lack of a better term, that gave us some ideas, and that would seem like one of the things that he mentioned that we could look into. On another issue that we spent a lot of time on was discussing the obesity in Mississippi and how to address all these weight loss drugs that have come along. I know they're very expensive. If we were $90 a month, it'd be one thing that would cure a lot of ills in Mississippi, but they're about $950, I think. How much is the rebate on that drug? What is our net cost? Do we know that? We would never be able to find out? Okay, but you wouldn't have any idea about how much the rebate would be? Or what about it? What about the same drug that's used for diabetes? What's the reimbursement on a $950 drug that's used for diabetes? Okay. Do y'all think it would be smart for a trial run, for lack of a better term, of 75, 100, 250, 500 obese Mississippians with a morbid obesity of 35% or more to invest in some of these drugs and do a study to see if that's going to be a panacea, as it seems like? I mean, I watch financial stock report stories in the afternoon, and on one particular day on one of these drugs, they came out with something positive, and it just changed the whole stock market. The drugs that were for orthopedics, their stock went down because they thought the drug would be so effective that the orthopedic costs would go down. The snack food industry, believe it or not, that particular day, the snack food industry took a hit. Walmart came out with a statement saying that they have seen that their snack food portion of their business has been affected by these drugs. And there's just so many things I guess we don't know about them. Would it make sense to do a trial run? And Mississippi would probably has the highest percentage of obesity in the state, in the country. Would it make sense?
I think, Mr. Chairman, we are looking at that right now. The committee came back to the board to say we need to do some more research on these diabetes drugs, what that would actually cost. So I think we are doing some of that work right now to try to come up with a better number. Can we afford it? How is this going to work? That kind of thing. So certainly we could do a trial run, but we're doing some research now to better understand what that would do to our bottom line.
We're charged with putting together a report of our findings to the legislature, and maybe we need to consider funding it, giving you an extra funding for that, which is one possible way of doing it. I guess if it were paid by the state, it wouldn't affect the plan any. That might make it a little bit more tolerable. That might be something I want to look into when we're compiling this report, Mr. Chairman.
Yes, sir. Any other comments or input from the committee members before we start making recommendations to include in the report?
I think the plan is always trying to balance good coverage for our members for the best price we can possibly do. And so that is becoming, I think, more and more difficult, but we are certainly doing everything we can to try to keep the cost down and still provide health care to the members.
That's a very tough job, I might add. Chairman DeBoer?
Yes,
Sorry.
thank you,
Sir.
Mr. Chairman. Having read everything that was submitted by all of the teachers and the various members, I have to say those are some very sad stories, and I hate to see them. Half of the recommendations are for increased coverage, half of them are for reduced premiums. And you know, if you solve one of those problems, you're going to exacerbate the other, right? There's no free lunch here. But I hate to see that, you know, as long suffering as the teachers of the state have been, when they get a raise, it goes away. The one thing I hope that they all will understand is that we're not sitting around a corporate executive table looking at ways to make money. We've taken down over 100 million in surplus in this plan because we had built a surplus through various circumstances, and we knew that that's their money. So we kept rates below actuarial levels for a number of years to basically find a glide path to where our current surplus target is. So, you know, no one's making money off of this. The most I've made in 20 years as a board member, I did get a free lunch at one of the board retreats, and I get free coffee at the meetings, but that's it. So I hope that's all understood. So that kind of leads us to, you know, why are we in this situation? And I do believe this task force will help in making some significant improvements to the plan that will save money and hopefully provide better coverage and more tailored coverage. But in the long run, the trends are what they are, and they're still going up. So we may be wrestling with these things in a few years, as we have been. I'll also say that the problems that are listed in these are not unique to the state health plan. I know from personal experience in my family with ADHD drugs and things like that, I've read about those, that private plans offer the same hurdles, the same complications, the same challenges, the same premium increases as we are. So we're not in a unique position, which leads me to believe we might be trying to solve a problem in this room that is bigger than this room. And that's going to be hard to do. I don't know if anyone in this room has ever wondered why health insurance is expected to be a benefit of employment. I mean, why don't we demand auto insurance from our employers? Makes as much sense, right? You got to get a car to come to work. So why do we do that? And if you have to go back, you go back all the way, and guess who stands in those starting blocks? It's the federal government. In World War II, FDR imposed price controls and wage controls. So people couldn't compete for employees. So the federal government, in their benevolence, allowed companies to deduct health employee costs as a legitimate business expense. And then all of a sudden, your health insurance was tied to your job. And the federal government, anytime they make a great economic idea and impose it on you, it never goes away. So that's why we're here. So no one is going to propose, certainly not the legislators on this group, that we're just going to do away with the plan. We're going to give the money back to the members and let them get their own insurance. It'd be devastating to the members. It'd be devastating to whoever voted for it. I know that. So, you know, where are you? I think at this point you have to try somehow through creative thinking to increase the economic incentives as the market would have them to the individual members to put the decisions back in their hands. The one thing I've seen in my lifetime that has done that is health savings accounts. And there's a lot of problems with them, but it makes an insured look at their situation individually and weigh it out and say, is this serious enough that I need to go into the doctor? Because if I have coverage, I'm just going to go if somebody else is paying. So that's been a good incentive that you can actually build your own account and then use it when you legitimately need it, but you're the one making the decision, not a third party or a third party incentive. And that gets over to the third party payer problem. Senator, you mentioned before the meeting in here that it seems to be a lack of sunshine and openness about some of the pricing. And that is shot through the entire medical industry because the insurance company pays so much, because the government pays so much, especially the federal government pays so much. They dictate prices, incentives are all messed up. So I think some of our answers do need, as you say, to go toward transparency, even if we buck the trend of other states. I don't know if they do it, but after 20 years on the board of the Health Insurance Management Board, to hear the PBM, and I know he has his own incentive to present this to the board. I know he probably wants to look at an RFP, and that's fine. But his presentation really opened my eyes just how convoluted this entire process is. And if we could get a weed eater out and just clean that out somehow, and I know pharmacy is the biggest piece, if we could somehow figure out a way to negotiate with a PBM that says, no, we're gonna know exactly what you make, and you're gonna make a fair amount, but you're not gonna change us from one level to the next and obscure things and make money on the back end. We're gonna know what you make. I think that would go a long way. I've enjoyed being on the task force, and it's been an honor.
Those are very, very insightful comments, and I would agree with you, sir. So thank you. We appreciate your attendance and you being on the committee. Any other input or comments from the members? Mr. Chairman DeBoer.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. I appreciate you chairing this committee, and you've done a very good job, both you and Senator Michelle. At the very beginning, I said I had a very limited knowledge on insurance and how it works, and I've learned quite a bit over these few hearings. But at the end of the day, I think we're at the same point, which you were talking about. Mr. Reed even talked about how do we reduce premiums, reduce deductibles? And I don't know, at this point, I have a clear picture of how to do that. And I don't know if it's increasing the state's subsidies for that to compete with Louisiana, Alabama, Arkansas, Tennessee. And so I'm hoping y'all can make some good recommendations to me, because I don't know if there's anything else we can do other than the state subsidizing those costs. And so as we prepare the report, I'm hoping maybe you all can provide a number or how we can reduce that to help people like Mr. Reed, and not just teachers, but state employees throughout our state, and on, because they're under the coverage just like teachers are. And I'm not trying to focus on teachers being the education chairman, but I really want all of our employees to have good coverage. And because if we keep doing these pay raises, I don't know how sustainable that is, but if the insurance costs are going up and our wages are, flatlining or they're going to be losing money. And so how do we stem that tide, I guess? And so maybe you all can help us provide an answer to that, whether it's a state subsidy or not. I don't know. So hopefully you can provide us some good options and we can go from there. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Okay, I don't want to cut anybody off. Any other comments or input before we take recommendations to include in the final draft?
One additional comment, please.
Chairman Michelle.
Just want everyone to keep in mind that the state is paying the health insurance for the employee. So teachers, state employees, and the state has increased. We've in our appropriation process every year, we've raised it approximately 6%. We had a big hit to the plan from COVID. We also put some of our COVID money in the plan. But so keep in mind that the employee is not incurring any additional expense. It's if they happen to have children, and that's a personal decision that they'll make. My sister has a husband and 8 children. There's 10 of them. So if we were to hire my sister to work for us, we would take on 10 people on that plan. Just keep it in mind that that's kind of the way the plan works, and they would be paying for the family plan. And I pay for, I have a plan and I pay for my wife, and I think I'm paying about $600. But if I had a whole family, isn't it about 850, 840? So you can go from one person for 600 or 10, literally my sister and husband and 8 kids for $200 more. That's a bargain, isn't it? So it's all relative but I just want to reiterate the point that we did not increase the pay for the plan for the employees. The state picked that up.
Thank you, Chairman Michelle. Okay, let's go ahead and take recommendations for the final draft. The House Chair will begin. I have several, and before I state these recommendations, most of them are being done by DFA now. And hopefully, if we follow some of these recommendations, I think we will see maybe not a drastic increase, ladies and gentlemen, but hopefully some type of decrease in pharmaceutical expenses. These recommendation statements are not made in favor or in opposition to any one subject matter, profession. You know, it's not showing favoritism to anybody. Some of you may recall the statement made early on by the chair that to me, individually, to me, the logic behind PBMs makes sense. They have a larger purchasing power than an individual. But having said that, I think, as you alluded to earlier, if we can have a little bit more transparency and assist the state and the state plan to ascertain that transparency and openness, I think that will go a long way in decreasing expenses. Having said that, the chair's recommendations include the following. Number one, we all saw the drug expenses and the prices that the state of California is paying, which is much, much larger than the state of Mississippi in population. Ladies and gentlemen, we do have 2 legal opinions on this recommendation. This is legal to do. The question will be the practicality and how do we accomplish it. Okay, required to the extent possible for the state of Mississippi's health insurance plan for its employees to enter into a compact with other state plans or other Mississippi political subsidiary entities. That will increase, hopefully, the purchasing power of the plan, and similar to what California and other larger states are paying for their pharmaceutical expenses, maybe that will help us to pay an equivalent amount. Any questions or comments? Yes, subsidiaries. All those in favor say aye. Opposed, nay. The ayes have it. That will be included in the report. The chair's second recommendation is to, and Ms. Liz, DFA does a very good job at this. Let's maintain the right to audit the books of the PBM. And more importantly, the aggregator. As some of you may know, that's the company that kind of keeps up with the rebate money. Allow that to be able to happen by an independent third party. We are doing that now. Let's make sure we maintain that. All those in favor say aye. Opposed, nay. The ayes have it. That will be included. Number 3, as we have talked about before, require absolute transparency and full pass-through of all revenue, whether it be rebates or not, from the PBM and from the aggregator that the PBM contracts with. Emphasis added, all revenue, no matter the form or what it is called or where it comes from, will be passed through to the plan. All those in favor say aye. Opposed, nay. That will be included. Next one. Preclude conflicts or the appearance of conflicts of interest between any and all parties involved, including the plan, sponsor, the PBM, and the aggregator. That should also, I believe, include full disclosure up front as to who the aggregator will be, or who will the PBM choose as the aggregator if they are granted the RFP. All those in favor say aye. Opposed, nay. That's included also. Okay. What I think is very important and needed, and I don't know, Ms. Liz, this may be done now. I'm not sure, but make sure that the PBM RFP requires upfront. Let me repeat that, upfront, a copy of each company's proposed contract, and not just any responses to questionnaires. In other words, the RFP will require each and every competing company to provide their proposed contract upfront to allow DFA and the state to review that proposed contract. All those in favor, say aye. Nay. The ayes have it. That will be included. I think this is very important also, members of the committee. Hopefully we can see that proposed contract up front, but I think the state needs to make sure that the definition of brand drugs, generic drugs, and specialty drugs are airtight with no wiggle room in terms of classification or definition. And again, that's why it's important to get a copy of that contract up front. All those in favor say aye. Opposed, nay. That will be included. If possible, and I will leave this up to DFA, make sure our plan is paying acquisition cost and not any type of negotiated price between the PBM and a subsidiary pharmacy that they may own or they may have an ownership interest in, or any type of legal relationship between the two. All those in favor say aye. Opposed, nay. That will be included. As to recommendations of the chair, do any other members of the committee have any recommendations? Senator Michelle, you're recognized.
Thank you. Mr. Chairman, on the subject that we spent a whole day on, and I discussed earlier on the problem of obesity in Mississippi leading the nation in obesity. I don't want to put a mandate on anything, but I would like to put as one of our summaries that we ask the State and School Employees Health Insurance Management Board to make a recommendation to the legislature if they think it would be a good idea to do a trial study on the benefits of on a selected number of people on one of the obesity drugs. Trial study to see if the cost benefit is there. And that's going to be it. The board can come back to us and say, no, I don't think it's a good idea. I'm not asking for any kind of mandate, but I'd like to look seriously at maybe doing a study. And then if they do say it's a recommendation, maybe a cost estimate, and it literally may be something we'd want to look at as a funding mechanism through our appropriations.
You've heard the chairman's recommendation. Any comments, responses, input? Okay. Okay, seeing none, all in favor say aye. Opposed, nay. The ayes have it. Okay, anybody else has it? Chairman DeBoer?
Thank you, Mr. Chairman. I guess following Senator Michelle's request for a recommendation, I'd like for the board to provide a recommendation as to what it would cost the state to reduce the premiums and deductibles. What amount of subsidy or cost sharing would the state have to pay to make us more competitive, I guess, with the surrounding states? And provide us, you know, maybe some tiers for the family or the single rate. I mean, $40 a month, that's that's a good amount, but is that appropriate rate? I don't know, but look at the rates, and if there's something the state needed to provide extra subsidy to reduce the premiums and deductibles, I'd like to have some recommendations for that, if I could, from the board, Mr. Chairman. And however you want to word that or phrase that, I'm not sure, but that's kind of what I'd like to see.
So you kind of want the board to just do a general overview and analysis and look at things one more time to see if there's any options or possibilities that we're not implementing now to reduce premiums.
And provide us some hard numbers, how much it would have cost, provided the legislature with some hard numbers. Yes.
Okay, you've heard the chairman's recommendation. All those in favor say aye. Opposed, nay. The ayes have it. That will be included. Any other recommendations, input, comments from the committee members? Okay, in conclusion, we will put these recommendations in a draft format for everybody to review, sign off. We'll probably just email the report to each member, sign off above where your name is printed and typed. And then we'll go ahead and submit that report again to the governor, the lieutenant governor, and the speaker of the House. And from me personally, I want to say again, thank you for your time and the effort that you have put into this. I think it's been very helpful, and I wish everybody a happy Thanksgiving. This meeting is hereby adjourned.